But moving on, disease outbreak in remote areas of Ghana are most often reported late or underreported due to lack of avenues to channel these reports to inform relevant national intervention. The Kwame Nkrumah University of Science and Technology is working on a mobile application which makes it easy for underserved communities to access healthcare. Love FM's Kwesi Deborah has more for Tech Thursday. Enjoy.
The mobile application, which has been developed under the mHealth project, can operate with or without internet. It has two sections, a part for ordinary Ghanaians and a place for medical personnel. The app will be used to gather data on disease symptoms, which will then be analyzed by medical personnel for swift intervention. To address language barriers, the app is equipped with language translation features. Beyond this, users can seek virtual consultation and emergency care, among others. Dr. Rosemary Usua-Mensah-Jinin is principal investigator of the project.
That is going to disseminate health information. We are going to use the app as a means to collect data, analyze the data to do forecasting predictions so that we can avoid some of the outbreaks that come around, or we can take in proactive measures to deal with emerging health challenges. So we are looking at a point where people will use the app, provide some information on, let's say, symptoms, and then we can come up to a certain point where we can say that we feel that people in the northern region are complaining about these symptoms within this time of the year. So what should Ghana Health Service do then? So we have medication reminders where people can log in the drugs they are supposed to take. So they can use the app to communicate among themselves, share relevant information, and also transfer patient history, make appointments as and when necessary. We also have avenues for emergency assistance and virtual consultations.
Dr. Emmanuel Ahene is co-investigator.
You would look at the regions we have in Ghana, you would realize that in almost every region in Ghana, there is this group of people who would have limited access to healthcare. And those are the people who are targets to ensure we use this mobile technology to enhance their access to healthcare.